Brad, I know it's a very complicated question, so if you can help me just to keep it on the simple side for the audience and brief, can you update us on about the BNSF case that ruled, that found Card guilty of 337 accounts of fraud? Can you give us very succinctly your, if you can, without jeopardizing legal action, an overview so our audience understands what you and Card are going through? If that's too much, tell me no.
No, I think I can talk about, the main issues, which I think everybody would like to know, are we fraudulent or not, And so where fraud became an issue was the, out of the interest of BNSF wanting, anyway, they filed a suit, a whistleblower suit, and the Justice Department looked at the situation, and they talked to me, and they absolutely had no interest in prosecuting us, but the railroad had that opportunity, that option to do it, which we didn't know, which kind of surprised, anyway, it happened. So the crux of all of this was they contended that people don't understand it, Senator Baucus in 2010 wanted to make sure with W.R. Grace's voluntary medical program going away, and that was there for people that were infected by asbestos. He wanted to make sure there was a piece in place for Libby where they could get care. And so he made Medicare available to people that had evidence of asbestos-related disease. And having that diagnosis meant no matter what your age was, you would have access to Medicare. You would be qualified. And so under the public health care law that Senator Baucus created, it stated in that Card were qualified physicians to make a diagnosis. But in addition to that a positive B read would be considered adequate to have benefits, and that's what had always occurred with all the other short-term healthcare supplements that the government had provided for Libby. So, in other words, they could have an X-ray, say that we saw them and we weren't convinced they had asbestos disease based on our assessment. If a B read came back that from when their films were sent out, which they were based on the requirements of our grant, we're required to send out films for outside readers, experienced readers. If they came back positive, even if I didn't think that I didn't clinically diagnose them, they would qualify. And so with that understanding of the law, and of course it's in our grant also, it was appropriate to fill out a form so that they could have access to Medicare benefits. The contention of the railroad was that we submitted claims that truly weren't diagnosed. And, not clinically diagnosed, but we followed the law. And our granting agency knows that, and they support us. We still have our grant for the federal government, but it's it came as a shock to us. But anyway, it's the way it was interpreted by the judge, and so we appealed it. It's sitting in an appeal, which who knows how long that is, but we followed the law. That's all I can say. We did it right, but sometimes things happen like that in the judicial system, and it definitely was a shock to all of us. We had no idea that there would be that kind of an interpretation. So,
well, we're sorry, and it's unregrettable isn't the right word, but we stand with you, and we hope that your appeal goes forward.